All right, next up, presenting on behalf of the team at Blue Diagnostic, please stand up and welcome Katie Brenner.
Wow, what an honor to be here. Thank you all so much. At Blue Diagnostics, our mission is to help women to understand their bodies and take control of their fertility. There are over 60 million women of childbearing age in the United States today, and over 30% of them fear that they have some problem with their fertility. In fact, 25% of all women will struggle at some point in their lives to get pregnant, and they're currently spending over $700 million annually in the United States alone on fertility-related tests. They're turning to over-the-counter solutions that give yes or no option answers and really tell them nothing about what their bodies are doing every month if the answer is always no. Or, after they've tried for a year, their physicians may prescribe months of blood testing and ultrasounds, and it's expensive, it's inconvenient, and after months of this, it can be inconclusive. There is currently no comprehensive solution available to women, and that is the void that Blue Diagnostics will fill. Our product is more reliable, it's more accurate, and it's more cost-effective than existing options. Fertility Finder is just a handheld device. To use it, a woman inserts a disposable paper strip into the device and then places the device into her mouth for about a minute each day. It's just like taking your temperature. But Fertility Finder makes quantitative measurements of fertility-related hormones in saliva and then transmits these results to a mobile app so that our users can interface with their data at any time or share them with their physicians. Our accuracy is enabled by the fact that we developed a new and more sensitive way of measuring hormones that are typically measured in blood in saliva instead, and we've submitted patent applications for the device and the method provisionally. Now, this accuracy gives our users three primary benefits, and the first of these is that we enable women to plan, because we tell them 2 to 4 days in advance about precisely when they're going to ovulate. That's not available anywhere else over the counter, and it enables our users to plan, which is crucial for women struggling. And the second benefit is that we tell women 10 days before they miss their period about whether they're pregnant or not, so we alleviate that stress of waiting to know the answer. That's 5 days earlier than any other existing over-the-counter solution. And then the third benefit, this is huge, because this isn't available anywhere else, at your doctor's office or at home. We actually give women an overall picture of their fertility so that they don't have to wait and wonder, is my body even able to get pregnant? No, we give them accurate, actionable information from the get-go. They can use this information to get pregnant, or they can take it to their physician to jumpstart treatment. We've assembled a dynamite team to bring this product to the market. Doug Weibel and I have a cumulative 30 years of experience in science and technology transfer, including previously developing devices with Medtronic, Amazon.com, and Google X. And Judy Schroll brings over 20 years of experience in business development and marketing in the pharmaceutical and biotech spaces. And our team has already made significant progress. So we've completed our proof of concept, and we've selected contract manufacturers and then divided our plan from here into 5 key tasks. We'll complete manufacturable versions of our disposable component, our reader, and our app by the end of 2016. In early 2017, we'll do our clinical study demonstrating that our results are equivalent to blood testing. And then after that, our FDA 510K pathway will take about 150 days. That's what devices just like ours are currently taking to get through the same piece of the FDA we need to go through. Our launch strategy is really tailored to our target customers. These are women who are struggling to get pregnant, and they're very active in several key online blogs and forums. So we'll reach them there and also sell online, and in parallel, we'll be developing relationships with physicians as key recommenders of our product. Following this plan, we'll have revenues of over $100 million in our 5th year on the market, and that's just with our core target market. If you take a look at expansion markets, women in perimenopause measuring the same hormones for their symptoms, and then international royalties, our revenues rise to over $172 million. In terms of exit possibilities, consumer products companies are really interested in us because we directly compete in their space. Diagnostics companies are interested in us because we have a platform technology. And of course, connected health companies are interested in the data that we can provide. With that, I'll close. Thank you again for this opportunity. And I just want to say personally that I'm so excited to be involved in building a company that's giving women the information they need to make educated choices about their bodies. Thank you so much.
Questions?
Yeah, I think this is a great time for companies in this space with fertility testing, with prenatal testing. I mean, there's just a lot of buzz in the area, so that's great news. I'm just trying to understand where you think your biggest differentiators. I mean, there are ovulation monitors that are out there. You know, I think Clear Blue is one of them, or just in terms of, and is it the fact that you can do saliva as opposed to urine or blood? Is that the main differentiator in your opinion?
All of the above. Actually, we measure hormones that physicians currently use to make actual diagnoses in the clinic. So our data is relevant to a woman who's struggling to get pregnant and would otherwise be going through months of blood testing to measure these same hormones and would not have nearly the granularity in information.
And is that the big issue, though? Is it the fact that they can't measure when they're ovulating, or is it other issues related, I mean, outside of that?
Right. I think there are many, many issues. One of the big issues is they don't have this hormone data available to them, so they're sent on a wild goose chase of potential treatment options that includes months of testing of these very hormones, and they have to wait until they've tried for 12 months to even get access to that test. So we can give that information to women much earlier, and our data can send them in the exact path of treatment they need. So if there are no problems with hormones, it saves them those months of testing. They can go straight to looking for a fallopian blockage, for example, or to looking for sperm issues. So we very clearly direct treatment. And of course, using saliva is a lot better than peeing on a stick or peeing in a cup repeatedly. Or going in for lab-based blood testing, right? So it's just win-win for everyone. And physicians say the same. They're like, I would love to be able to send my patients home with this when they come to me, because otherwise I have to tell them wait 12 months and then come back. So yeah, it's beneficial to everybody.
So it seems like you're fairly early on from a validation perspective here. I'm just curious to hear kind of what work has been done on the either customer research side or anything along those lines to get you to this point.
Yep, we've done customer research marketing strategy surveys, and there are a lot of results I can talk about from that. For example, we know that 36% of women actually feel that they have a problem with their fertility. We know that 88% of women prefer to buy our product online, and we've done some validation on our pricing. So are there other specific questions about that?
No, I was just curious to hear how that had progressed to this point. So.
Yeah, actually we've done a large survey. It was pretty representative across the country, really hitting the major metros as well, and hitting a demographic from ages 21 to 44. So, trying to be as broad as we can. And these are all women, not women struggling. So we are surveying everybody, and 36% say they fear they have a problem with their fertility, even before they've tried to get pregnant.
Can you talk a minute to your intellectual property? I don't know if you mentioned it much.
Yeah, absolutely. I don't think we talked a lot about it.
Yeah.
So we have currently submitted provisional patent applications, and we are working on diversifying that portfolio into a set of patents. So we'll be bracketing our device and our method. And then in addition to that, we have very clear individual patents on biologics associated with our device. So it's kind of a family of patents, one of them centered around the reader and that novelty, and then another centered around biologics that are associated with the disposable strip.
Now, was this all IP created by you guys within the company, or have you licensed this out of the university?
No, actually, this is created by us, and it is fully owned by us, and we have all of our documentation from the university. But yes, I am at the university, so yeah.
Thank you.
So I love this stuff. I think it's made. I don't think it's almost like magic. You put a stick in your mouth and then all this stuff about yourself. But can you imagine that would women use this for much more than just be on top of their fertility, just being on top of their cycles and and when
absolutely
yeah.
So that's actually a two-part question. So do we assume that women will use it for a long period of time? No. So our numbers actually assume that our core target market will only use it for 4 months total. So that's pretty conservative because women try for years, right? But we anticipate that this device can become a lifestyle because women want this information, right? You want to know what your hormones are doing. Why am I in a bad mood today? Why do I have a migraine headache? All these things are hormonal. We've never had access to this information before, and it could be so valuable. And in fact, I mentioned perimenopause a little bit, but I mean, once you get into that stage, you're having all these crazy symptoms, and your doctor just says, hey, go home, too bad for you. Finally, you can actually measure and understand that more granularly and go to your physician and say, hey, look, my estradiol's all over the place. I think it's time for some of these new hormone replacement therapies that are currently coming on market. It's another place where we might actually have a really interesting partnership, like with pharmaceutical companies who want to direct customers to our product. So
Katie,
yeah, we anticipate it's a lifestyle.
You're telling me I can tell my wife that her estradiol is higher, so that's why she's in a bad mood?
No.
Good luck with that, right? No, she can tell herself. She wants to know.
I'd like a note
but
from
you know
you
what?
on that
For
one.
For you, I've got low T in the pipeline.
Okay.
Because this is a platform. I can measure any hormone in saliva. So actually our next, we have numbers on that too. You didn't see them today, but our next target market is low T, testosterone. So we can measure that and then send customers toward the therapies when they need
You shouldn't be talking to me about that, maybe.
Oh, sorry. That's right.
Yeah.
All right,
One thing,
yeah.
like, is there a way to express the precision of what you're doing? Like, are you 99% precise?
Yes.
Are you 80% precise?
Yeah, absolutely. Actually, so our clinical study is going to demonstrate that we are 99.9% aligned with blood testing. And that's really the gold standard. That's what physicians rely on, right? So if we can prove that that's where our accuracy is, which we can, then we believe that this will be very trusted among physicians and their patients.
All right. That's time one more time for Katie Brenner and Blue Diagnostics.